The efficacy of turmeric in managing health conditions, a brief overview. Hello, everyone. Today, we're exploring the health benefits of turmeric, a golden yellow spice long prized in traditional medicine and now gaining scientific acclaim for its potential in managing various health issues. This summary evaluates scientific findings on turmeric's active component, curcumin, and its efficacy in addressing inflammation, oxidative stress, and other common health concerns. This information aims to summarize research findings on turmeric and is not intended as medical advice. Consult with a healthcare provider for medical guidance. Curcumin, turmeric's active ingredient. Curcumin, turmeric's main bioactive compound, is responsible for most of its health benefits. This polyphenol exhibits strong anti-inflammatory, antioxidant, and antimicrobial properties, although it has limited absorption, bioavailability, in the body. To enhance its effectiveness, various formulations have been developed to improve curcumin's absorption. Anti-inflammatory benefits. One of turmeric's most recognized benefits is its powerful anti-inflammatory effect. Chronic inflammation contributes to numerous conditions like arthritis, cardiovascular disease, and metabolic syndrome. Curcumin inhibits inflammatory molecules, including NF-kappa B and COX-2, which are central to the body's inflammatory response. For instance, a study in Phytotherapy Research noted that curcumin significantly reduced inflammation markers in osteoarthritis patients. Another study published in the Journal of Alternative and Complementary Medicine found curcumin as effective as ibuprofen in reducing pain and improving knee function in osteoarthritis patients, suggesting it as a natural alternative to traditional anti-inflammatory drugs with fewer side effects. Antioxidant properties. Oxidative stress, due to an imbalance between free radicals and antioxidants, is associated with diseases like cancer, neurodegenerative disorders, and cardiovascular disease. Curcumin acts as a potent antioxidant, scavenging free radicals and enhancing the activity of the body's antioxidant enzymes. Research in antioxidants highlights curcumin's ability to neutralize free radicals and protect cells from oxidative stress. Additionally, a review in Molecules noted that curcumin boosts enzymes like superoxide dismutase, SOD, and glutathione peroxidase, GPX, further supporting cellular health. Cardiovascular health. Cardiovascular disease, CVD, remains the top cause of mortality worldwide. Curcumin's anti-inflammatory and antioxidant properties are beneficial in preventing and managing heart disease. Studies suggest that curcumin enhances cardiovascular health by improving endothelial function, essential for maintaining blood vessel health. A study in the American Journal of Cardiology showed curcumin's role in improving endothelial function, while research published in Nutrition Research revealed curcumin's capacity to lower LDL cholesterol and triglycerides while raising HDL cholesterol in patients with metabolic syndrome. These results indicate that turmeric may help reduce cardiovascular risk. Metabolic syndrome and diabetes. Curcumin has shown promise in addressing metabolic syndrome, a cluster of conditions like obesity, high blood pressure, and insulin resistance that raise diabetes and cardiovascular disease risks. In diabetes care, a randomized trial showed that curcumin improved insulin sensitivity and lowered blood glucose in type 2 diabetes patients. A meta-analysis in Critical Reviews in Food Science and Nutrition further confirmed that curcumin effectively reduced blood glucose, HbA1c, and insulin resistance, underscoring its potential as a supplementary therapy for managing diabetes. Neuroprotective effects. Curcumin's neuroprotective qualities have been investigated for neurodegenerative conditions like Alzheimer's and Parkinson's, which involve inflammation and oxidative damage in the brain. Studies suggest curcumin can improve cognitive function and delay disease progression. In the Journal of Alzheimer's Disease, curcumin improved cognitive performance and reduced amyloid plaque in Alzheimer's patients. Similarly, pharmacological research demonstrated curcumin's effectiveness in preserving neuron health and motor function in a Parkinson's model, indicating that turmeric might slow neurodegenerative processes. Cancer prevention and treatment. Curcumin exhibits anti-cancer properties through mechanisms like inhibiting cell proliferation, inducing apoptosis, cell death, and preventing angiogenesis, tumor blood supply. A review in Cancer Letters explained how curcumin interferes with several cancer-related pathways, such as PI3K/ACT and WNT/beta-catenin. Furthermore, Molecular Cancer Therapeutics reported that curcumin could improve the efficacy of chemotherapy and radiotherapy while reducing their side effects, supporting its role as a complementary cancer therapy. Gastrointestinal Health. Traditionally, turmeric has been used to address gastrointestinal issues such as indigestion, irritable bowel syndrome, IBS, and inflammatory bowel disease, IBD. Curcumin's anti-inflammatory and antimicrobial effects contribute to its digestive health benefits. Studies published in Gut found curcumin effective in alleviating IBS symptoms like abdominal pain, while research in clinical gastroenterology and hepatology reported that curcumin induced remission in patients with ulcerative colitis, suggesting turmeric's effectiveness in treating digestive conditions. Skin health. Curcumin's anti-inflammatory, antioxidant, and antimicrobial properties benefit skin health, aiding in wound healing and alleviating skin disorders. In biofactors, research indicated that curcumin improved wound healing and reduced chronic inflammation. Another study in Phytotherapy Research found that curcumin-based treatments were effective for managing psoriasis, underscoring its therapeutic potential for skin health. Respiratory health. Respiratory conditions like asthma, chronic obstructive pulmonary disease, COPD, and allergic rhinitis involve airway inflammation and oxidative stress. Curcumin's anti-inflammatory properties make it valuable for respiratory health. In respiratory research, curcumin supplementation reduced airway inflammation and improved lung function in asthma patients. Additionally, clinical and experimental allergy noted curcumin's effectiveness in alleviating allergic rhinitis symptoms, suggesting turmeric may support respiratory wellness. Safety and dosage. While turmeric is generally safe, excessive or prolonged use may cause gastrointestinal issues or interact with medications. Combining curcumin with piperine, from black pepper, or using specialized formulations can improve its bioavailability. It's advisable to consult a healthcare provider before starting curcumin supplementation to ensure safe and appropriate dosage. Conclusion. Scientific research strongly supports turmeric's role in managing common health conditions. With anti-inflammatory, antioxidant, and antimicrobial benefits, it stands out as a versatile natural remedy. From its ability to alleviate inflammation and oxidative stress to its neuroprotective and cardioprotective properties, turmeric offers health benefits that extend across various systems in the body. Whether used as a dietary supplement, topical treatment, or culinary spice, turmeric is a well-researched, trusted, and promising addition to health routines. However, using it responsibly and consulting a healthcare provider for personalized advice on dosage and formulation is essential. Disclaimer: this information aims to summarize research findings on turmeric and is not intended as medical advice. Consult with a healthcare provider for medical guidance. Thank you for joining this discussion on turmeric and its potential benefits.